Okay, questions for you. Question 1. A 20-year-old male collegiate lacrosse player is diagnosed with infectious mononucleosis after presenting with fever, pharyngitis, and posterior cervical lymphadenopathy. He is eager to return to competition. According to current guidelines, what is the minimum recommended time from symptom onset before this athlete may return to his sport? A, 1 week, B, 2 weeks, C, 3 weeks, D, 4 weeks, and E, 6 weeks. The correct answer, according to current published guidance by the AMSSM and ACSM, is to wait at least 3 weeks from symptom onset due to risk of splenic rupture. Question 2. Which of the following statements about splenic rupture in infectious mononucleosis is most accurate? A. Splenic rupture occurs approximately 5 to 10% of patients with infectious mononucleosis. B. The majority of splenic ruptures in mononucleosis are caused by direct abdominal trauma. C. Splenic rupture risk peaks at approximately 2 weeks after symptom onset, and the majority of cases are atraumatic. D. Spleen size measured on a single ultrasound reliably predicts the risk of splenic rupture. E. Splenic rupture in mononucleosis carries a mortality rate of less than 1%. The correct answer is C. Splenic rupture occurs in mononucleosis in less than 1% of patients. When reviewed in a systematic review of 85 cases, the average time from symptom onset to splenic rupture was approximately 2 weeks, with the majority occurring within 21 days. Critically, only about 9 to 17% of splenic ruptures were traumatic, and the majority are atraumatic. There is no data correlating a single spleen size measurement to rupture risk, and the overall mortality rate of splenic rupture in mononucleosis is approximately 5 to 9%. Question 3. A 17-year-old female cross-country runner presents with 3 days of fatigue, sore throat, and low-grade fever. A rapid heterophile antibody test, also known as a monospot, is negative. Which of the following is the most appropriate next step? A. Diagnose with viral pharyngitis and clear the athlete for full athletic activity. B. Prescribe amoxicillin empirically for presumed streptococcal pharyngitis. C. Repeat the monospot or obtain EBV-specific antibody testing. D. Order an abdominal CT scan to evaluate for splenomegaly. E. Prescribe a course of systemic corticosteroids. So the correct answer is C. The heterophile antibody test has a sensitivity of 87% and a specificity of 91%, but it carries a high false negative rate during the first week of illness. So if an athlete presents in that first week, the answer is to repeat the monospot or do additional testing to evaluate for the presence of Epstein-Barr virus-specific antibodies and consider obtaining a CBC. Next question. A team physician is managing a 21-year-old collegiate football player diagnosed with mononucleosis 2 weeks ago. The athlete is now afebrile, reports improved energy, and has a normal clinical examination. He requests clearance for light aerobic exercise. Which of the following is the most appropriate management? A. The athlete must remain on complete rest until 4 weeks from the symptom onset. B. The athlete may begin supervised, non-impact, low-intensity aerobic activity, but should avoid contact sports for at least 3 to 4 weeks from symptom onset. C. The athlete may return to full contact football practice immediately since he is asymptomatic. D. An abdominal CT scan must be obtained before any physical activity is permitted. And E. The athlete should be started on antiviral therapy before returning to any exercise. The correct answer is B. Current guidelines support initiating supervised, non-impact, low-intensity aerobic activity at 2 weeks from symptom onset in athletes who are afebrile, have adequate energy, and demonstrate clinical improvement. Contact or collision sports should be avoided for at least 3 to 4 weeks from symptom onset due to the risk of splenic rupture. Thank you.